And welcome back. Now, the South African Pharmacy Council says that it is distancing itself from false and malicious information, that they have instructed registered professionals to support the National Health Insurance, or NHI. Now, to clarify this matter with us from our Pretoria studio is the Registrar and CEO of the South African Pharmacy Council, Mr. Amos Masango. Thanks so much and welcome to Morning Live.
Thank you, Sakina. Thank you for inviting us to Morning Live.
Mr. Masango, let's start with the genesis of this particular issue. So what has happened to bring us to this point where you feel the need to clarify misinformation that has been put out in the public domain?
I think, Sakina, what needs to be clarified is that we had a conference, the pharmacy conference in Sun City, just beginning of the month. And like as we have always invite, stakeholders to come and to present on various issues, in this thing in pharmacy. So NHI was one of those things, that were discussed quite lengthily at the conference. And the Minister of Health was also there, because we invited him to come and open the conference, and then, but as well as, clarify the audience on the issues around NHI and so forth. And so during that process, there were a lot of delegates that pledged for the support for this thing for NHI. And so, and you can imagine, people just showing by the show of hands, and stuff like that. But now the request from the minister was that perhaps these pledges needs to be, put in a written form. So that's where the whole issue actually now came from, because then we then tried to help the situation by now sending the request to the delegates, just for them to put it in writing. Their pledge, for support for NHI. So and that's why I think many people actually, in fact, came in, and because they lacked this thing. They lacked more information around the issue, and then they just went on talked about the matter without proper information, and the whole issue now just went out of context. So our today here, in fact, for me, is just to try and context, and we also issued a media statement on this matter, just to try and allay the fears, because now what is being put out there is that perhaps we lack independence. Our organization is known to be independent. We are a statutory body that serves everybody, and without being partisan to anything. So, and that is where we wanted to just try and put everything into context.
Why, Mr. Masango, was there a need for people to pledge their support in writing?
No. Like as I'm saying, this was done by show of hands. How do you show that if people just raise their hands and say no, I'm supporting? So that was the request from the minister to say, can they be able to put it in writing? And that was the request really.
But don't you think that that was untoward? Don't you think that placed undue pressure on the professionals who were there? Whether they support NHI or not, surely that wasn't the platform where it ought to have been raised. Wasn't it unfair to ask them to make any indication at that point?
It wasn't pressure, because if you support, and especially when you are requested, there's no way where it says we are obliging you to do it. You can support, and if you feel you don't want to support, you don't want to support. I don't think there was really any prejudice to delegates on the issue, whether they needed to support or not.
Now, the Solidarity Occupational Guild for Healthcare Professionals, they say that the SABC made veiled threats against pharmacy practitioners who do not support the NHI. What's your response to that?
Sakina, there was no threat, and I think even if you can look at the message that was sent through to the delegates, there was really no threat, because it simply just said, at the conference of pharmacy which took place on such a date, the minister requested. So, and people should underline the word requested, because essentially that's what happened. He requested. So when you request something, it does not automatically mean that, you are obliged to either give in to the request or not. It simply is just a request. So you have a choice either to agree with the request or not.
So was that the sum of your correspondence? Because why would they say that there was a veiled threat contained therein?
There was no threat. There was indeed no threat. I think that is why I'm saying that. I think people who are saying there was a threat, they are really lacking context. And I think if you look at those people that are saying this, there were people who did not, in fact, even feature at the conference. They never attended the conference. It was just a hearsay, and then now they are taking this matter in this form. But necessarily, there was no threat to anyone. So you could do it, or if you don't want to do it, and then you leave it just there. I mean, there was really no threat to anyone.
So what is the South African Pharmacy Council's stance on NHI?
At the moment, Sakina, we don't have a stance on NHI. So we are going to comment like anybody else on the NHI bill. But again, that does not mean that we are not supporting this thing, or we are not expressing any view to the UN the development goals for this thing, for healthcare. I mean, especially, if you look at the development goal number 3, which talks on the member states, for instance, that they need to achieve the universal healthcare coverage for all by 2030. So we are supporting any cause, that looks at that. I mean, in whatever way it comes. I mean, it may come in a form of an NHI, or it may come in another alternative model. But all what we are saying is that we will support any cause. So, and we are saying to our pharmacists that they must actually participate, get themselves the know-how as to what cause is pursued, and then so that we as a statutory body can also be able to to support. I mean, by the way, our mandate comes from the Pharmacy Act, and Pharmacy Act tells us about issues that we have to this thing, to be following, and stuff like that. So if those things, for instance, are at loggerheads with whatever system of healthcare that South Africa wants to adopt, we have to sit down with the profession again and say, okay, we need to change this and that, so that we can be able to support or to enable whatever course that the country wants to follow.
Final question. Reports that pharmacy practitioners will be deregistered if they do not support NHI. Is there any truth to that?
There's no truth in that. There's really no truth in that, because the message you sent through was just simple and straightforward. There was really no truth in that.
So we unfortunately have to leave it there, but thank you so much for your time this morning. And that was, of course, the Registrar and CEO of the South African Pharmacy Council, Mr. Amos Masango. Thanks for talking to us about the Pharmacy Council and National Health Insurance. Let's take a break.